Welcome back to the Rick Smith Show. Check out our website, thericksmithshow.com, as we spend a little time here in Washington, D.C. for the Rise Up Protest to Power Convention, the first convention by the People's Action. A number of groups have come together to form this. We used to do a ton of these kinds of events over the years, and now People's Action has put it together here this week. We're talking about healthcare, one of the things that I think is extremely important. And what we hear from the right wing, well, it's killing small business. I'm here to talk a little bit about how it's affecting his small business. I've got Kelly Conklin. He's the managing partner with Foley Waite LLC, also an executive committee member with the Main Street Alliance. Kelly, thanks for sitting down with us.
Oh, thank you for giving me the opportunity.
So, I look at this convention and I look at, can we start that over? Or is this live? It's live. Let's start this over. I didn't record it. Welcome back to the Rick Smith Show here in Washington, D.C. for the People's Action Rise Up Protest to Power Convention. We're sitting here talking about health care, something, again, I think extremely important. The right-wing frame we hear quite often is how the health care is killing small business, which is why we want to talk with Kelly Conklin. He's the managing partner with Foley Waite LLC. He's also an executive committee member with the Main Street Alliance. Kelly, thanks for taking time for us.
Thanks for having me.
So what do you think of this event? I mean, this is impressive.
It is, and I worked with the Alliance for a Just Society to put this convention together, and our goal was to empower those who have been traditionally excluded, and it's just terrific to see the people here today who are representing those communities.
Yeah, I mean, you get this a lot. I mean, I talk to especially my right-wing Republican friends who, these are the problem people. These are the people, and again, I get, as people go, as a white guy, why do you care?
Right.
As a small business owner, why do you care?
Well, I care because the people that actually make it possible for us to turn a profit are the people that come from these neighborhoods and from these backgrounds. My business has depended on immigrants, and it has depended on people of color and people who don't necessarily speak English as a first language, and without them we wouldn't have a business. So I have a direct investment, and they have a direct investment in my business. So it's a mutually empowering and sustaining relationship.
Right. But then, again, you come back to this and you go, what is the goal of having a business? What is the goal of business in this country? Is it purely about making as much profit as possible, or is it about improving the community and helping people to move forward?
Yeah, I think it is about it. It's about improving the community. It's about being a responsible community member. And it's also about creating an environment that you want to work in and that your employees want to work in. And for us, for my wife and I, who started this business in 1978, that's been a core philosophy, and it's reflected in the results we get from our employees.
Right. Now, healthcare is front and center right now. And, as a small business owner, what did the ACA mean to you? What does it mean in managing your business?
It simplified the purchase of healthcare, and it relieved me of an enormous burden, a moral and ethical burden, because I was charged as the employer with the responsibility of making year-over-year decisions for all of my employees that affected directly their health and well-being and their financial security. The Affordable Care Act made it possible for me to make, for the first time, a secure, informed decision about purchasing health insurance for me and my employees, and I'm on the same plan my employees are on.
Okay, but here's the thing. You got into business, why?
Well, I got into business to, like I said, create an environment I wanted to work in, to produce a high-quality product that would last, a durable product, and to give myself a sense of accomplishment, both in terms of what we produced and how we produced it and who we produced it with.
Right, I didn't hear healthcare in there.
No. That's true.
I didn't hear buying and choosing, because we hear a lot of this nonsense, don't we? We're going to give you choices. I don't want choices. I want to know that when I'm sick, I get to go to the doctor. If my kid falls and breaks his leg, we're going to go get it fixed. That's what people want. We don't want choices.
You're absolutely right. And the whole nonsensical meme of the last attempt by Republicans to so-called reform or replace the Affordable Care Act was that people wanted access to health insurance. We have access to health insurance. We don't need access to health insurance. We need access to health care.
And we need healthcare that when you get sick, you don't go broke.
Absolutely.
Because here's one of the knocks against the ACA, and maybe you'll agree, maybe you won't. They're high deductible plans. So if you do get really sick, there's still a financial burden to be paid.
That's correct, but I think you have to walk that back. The reason you have high deductibles is to keep premium costs down. The reason we need to keep premium costs down is because we're sustaining a for-profit insurance industry and because tens of millions of Americans still remain uncovered. So when you have to split the cost of the uncovered among those who are actually providing coverage, the premium costs are going to be much higher. You want to solve the problem of high premium costs? Guarantee every American has access to a doctor, access to a hospital, access to medication, and access to therapy when they need it.
Yeah, but there's no profit in that, Kelly. Come on.
Well, there
The
isn't.
shareholders aren't going to get wealthy.
That's true, and that's a decision we made as a country politically to empower corporations in ways that don't make any sense.
Did we make that decision, or was it made for us? Because look, I'm old enough, and maybe you are too. I'm old enough to remember community hospitals.
Right.
In fact, I was born in one where the community funded them. You didn't have to have a bean counter trying to figure out how to stay afloat. You had doctors running the hospital. I know, novel concept, but you actually had actual physicians who were worried about people's care instead of the bottom line running these hospitals.
That's absolutely right, but we made a political decision in 1980 when Ronald Reagan declared government was the problem,
Right.
that government was the problem. We bought into that idea. And when we did, we began the process of privatizing everything. And it turns out, in fact, that the private sector is unable to do some things well. And one of the things that is absolutely unable to do well, and we have now all the proof we need, is to provide health care for everyone. It can't do it.
Right.
And if we keep repeating this, we're going to keep driving ourselves deeper and deeper and deeper into economic and moral bankruptcy.
Yeah, you're absolutely right. But Kelly, here's the thing: we hear that competition argument a lot. If we've got more competition in the marketplace, it's going to bring costs down. We're going to get rid of those inefficiencies. We're going to squeeze out all of those needless costs.
Right, except that when you keep the door closed and only open it for those who can provide proof of coverage, then you still have that problem. You're never going to squeeze that out. Our choice, our moral and ethical choice, is we do away with the concept of first do no harm and lock the front door of the emergency room. And the only way you get in is if you can slide your medical card and have access to the emergency room. Otherwise, and let people die in the street. Or otherwise, we have to recommit ourselves to the notion that healthcare is an absolute right, and we are going to do whatever it takes to make sure every single American, the day they're born, has a card that they give up the day they die that guarantees access to medical care. Period. That's how we solve this problem.
And it makes perfect sense to me, but evidently we can't do it because there's a lot of money to be made in it. I keep coming back to that point. And until we get away from the idea that we're married to the free market and we're married to profiteers, I don't know that we can get anywhere past that. So in looking at this convention and looking at what you're seeing here, is there a moment where, the angry people, and there are a lot of angry folks out there, start demanding this?
Yeah, I think we're there. I think we are there. I think people have begun to put two and two together. We're capable of simple math. We are capable of understanding the underlying realities of the problem. And I think finally people are saying, okay, now we need to step back and figure out what the appropriate means are to solve this problem. Because that's what we're really talking about. We're talking about where the money's coming from and where the money's going. I honestly don't care how we get there. If we have Medicare for all, that would be great. If we have some combination of private and public finance of health care, that's fine with me too. What matters to me is that concept of that card that you get at birth and that you give up at death.
Cradle to grave.
Cradle to grave.
And again, you start thinking about if you have that kind of an environment where you do have the cradle to grave mentality and not this, if we have healthy people working, they have jobs, therefore they have insurance. As soon as they're off the private insurance, they're on the back of the government. When you have that divide, there's an incentive to deny people who are healthy access to preventative care. Uh, Makes perfect sense. You're not getting the preventative care you need so that when you do get diabetes or you do get sick down the road, you're somebody else's problem.
Right, but we're except that's a false notion from jump. You're not somebody else's problem. You're still our problem. The problem does it's a practical problem, right?
Right.
I mean,
But in when I say our problem, I mean the insurance companies. Because the insurance companies, they're in business to make money. They're providing insurance and health care is secondary. The primary goal, how much money can we give to the shareholders?
right, and you just hit the nail squarely on the head. It is about profit, and it is about shareholders, and it isn't about health care. So the potential for the private insurance industry to play a part in this is perhaps real, and it can't necessarily be done away with entirely. However, there is still this vast open space in between who can afford that and who can't, and who can make a contribution toward it but can't afford the whole thing. That whole middle space there, that has to be filled by something that actually works.
Right. Last bit of questioning, because I'm of the mindset you have to have one big pool. Just basic, simple insurance pooling. Everyone's got to be in. Healthy people, sick people, people in the middle, to defray the costs for everybody. That's the only way I see it working. Having these Band-Aid programs, having this hodgepodge system of how we pay for things is just horribly inefficient and extremely expensive. And we've got to get past that. But yet all I keep seeing coming out of Washington is more free market, invisible hand, consumer choice nonsense.
And I couldn't agree with you more. And until Washington wakes up to this underlying reality and is willing to make the political investment as well as the financial investment in the well-being of the American people. I mean, I thought that was why these guys were down here. I thought that was what they were supposed to do. And somehow or another, they've gotten lost. So people's action is about getting them refocused.
And getting us focused to take over those jobs if they don't.
Right.
Kelly
exactly.
Conklin, I appreciate the time. Thank you so much. It was a pleasure talking with you.
Same here. Thank you.
Let's take a quick break here from Washington, D.C. You're watching The Rick Smith Show.